Hopefully, by now, you can appreciate this continual, delicate, and precise balance between the hormones of the body. The pituitary must continue to function at optimal levels. Activity levels must not be excessive or insufficient. When the pituitary produces an excess of one of its hormones, here are a few of the possible resulting conditions. Acromegaly. This is a condition which causes facial features to become coarse and rough, a deepening voice, an unnatural growth of hands, feet, and skull, high blood pressure, high blood sugar, cardiovascular problems, sleep apnea, carpal tunnel syndrome, increased snoring and pain, especially headaches. Cushing's syndrome. This debilitating condition occurs when the body is subject to a constant overload of cortisol, the so-called stress hormone. This can result from an overuse of corticosteroid medication, overtraining, inability to deal with stress, poor nutrition, and depression. It may cause weight gain, increased fat deposits, high blood pressure, anxiety, depression, muscle weakness, weakening of bones, and cognitive impairment. This is a non-cancerous or benign pituitary tumor that produces a hormone called prolactin. The result is too much prolactin in the bloodstream. This can cause headaches, decreased libido, infertility in women, erectile dysfunction in men, vision problems, nausea and vomiting, and challenges with the sense of smell. When the pituitary fails to produce a sufficient amount of its hormones, the possible results include diabetes insipidus. This is an uncommon disorder that causes an imbalance of water in the body. Naturally, this causes intense thirst even after drinking copious amounts of liquid and excreting massive amounts of urine. Injury to or tumors of the hypothalamus, which carries over to the pituitary. After listening to the consequences of pituitary dysfunction, you can now see how important the healthy function of the gland is. To help you avoid these problems, let's review the causes of them. Pituitary tumors are the most frequent cause of pituitary problems and regrettably are somewhat common in adults. The good news is that they are not brain tumors and are usually benign, non-cancerous. There are two types of pituitary tumors: secretory and non-secretory. Secretory tumors produce an excess of pituitary hormones while non-secretory ones do not. However, both of these can wreak havoc if they become too large and begin to adversely affect the normal functioning of the pituitary or other close glands in the brain. There are three categories of problematic conditions arising from these tumors. Hypersecretion. An excess of hormone levels in the body may be due to a secretory pituitary tumor. Hyposecretion. Insufficient levels of any hormone in the body may be a result of a large pituitary tumor which puts direct pressure on the gland, which interferes with the gland's ability to produce the standard level of hormones. This can also result from surgery or radiation of a tumor. Tumor size effects. As the tumor expands, it presses against one or more of the glands in the region, including the pituitary. The common effects are headaches and vision problems. As the tumor enlarges and continues to pressure the pituitary, this can result in the previously mentioned symptoms. In addition to tumors, other causes of injury to the pituitary gland are particular types of medications and traumatic injury to the brain, which can result in bleeding inside the brain close to the pituitary. Also, the pituitary can suffer damage from infections, tuberculosis, sarcoidosis, an inflammatory affliction that affects many organs in the body, usually the lungs, congenital and genetic origins, and ischemia, restriction of blood supply to tissues, resulting in a shortage of oxygen or glucose necessary to keep the cells of the tissues alive. Finally, there is a third condition causing pituitary problems, hypopituitarism. This is a rare condition that affects less than 200,000 people in the United States annually, with an incidence of 4.2 cases per 100,000 folks per year. There is a particular subset of the population that is overrepresented in that statistic: anyone who has experienced a brain injury. The definition of hypopituitarism is a condition in which the pituitary gland fails to produce one or more vital hormones or doesn't produce them in sufficient amounts. The symptoms of this disease are similar to the symptoms resulting from hormone deficiency I previously listed. The first step in treating pituitary disorders is to identify the exact cause of the condition and the particular hormone that is causing the problem. Then the correct course of action can be determined. Often, hormone replacement therapy will be used to treat hypopituitarism. There are some situations where proper management of the condition will result in a full recovery, and treatment may no longer be necessary. There are other instances where no treatment is required. However, there are times when the hormone replacement therapy must continue on a lifelong basis. Therefore, it is of vital importance for patients undergoing this therapy to be aware of any changing circumstances in their lives that may require an adjustment to their treatment. An increased level of hormone is needed during times of high stress. This requires regular blood testing to keep an accurate measure of a patient's hormone levels. There are circumstances when surgery and radiotherapy may be needed for some patients. If the problem is an expanding tumor in the brain, it might have to be surgically removed or killed with radiation. As with so many health issues, it all comes down to the ancient cliche: an ounce of prevention is worth a pound of cure. In other words, do all you can to protect your head. Wear protective headgear when you are in any environment or doing any activity that would have the risk of head injury. Consider adding balance training to your exercise routine to prevent falls. It can be as simple as just taking the time to stand on one leg for a minute or two during the day. As we age, the consequences of falling are increasingly devastating, and having the right balance will put the odds in your favor. There are also many types of fitness equipment geared toward equilibrium. Prevent falls and protect your precious brain. Most importantly, slow down. All too many accidents are a result of someone being in a hurry. Common sense needs to prevail. An extra minute or two here and there, as opposed to a lifetime of pituitary problems, should be rather easy to measure, and even easier to arrive at the correct conclusion. Your endocrine system is a delicate, intricate system. Respect it, and it will continue to work its miracles for you.